You're tuning in to Past Our Prime, a show powered by Squadlocker.
Let's be great. Let's be great.
Here are your hosts, retired Astros minor league star Tip Fairchild and former Patriots All-Pro center Dan Copen.
Go rock this thing, huh? Love you, man. Let's go get it.
No, we can leave it on.
Why?
It's nice. So we see if we're in a fat position.
That's why you're
We both have the white. We both have the white hoodie. Look at our white hoodies, Max.
It's White Hoodie Day at Squadlocker.
Top Gun, John Deere.
Episode 66, Past Our Prime. We're back, and Max is pretty excited today.
Max has been excited for a few weeks trying to get this guest.
Max
in here.
was shitting bricks early on, and he's like, the background is we have a guest in studio today. Max will do the introduction, but for the last 20 minutes, Doc, he's been like just going to the window, like waiting and like just not messing this one up. Because the background is your fiance.
Yep. So far, so good.
Is employed, and if you fuck up today,
this is
then
bad.
she's going to get fired.
Yep.
That's true.
So allow me to introduce you guys to Dr. Thomas Rocco. And Meg, my fiance, works for Dr. Thomas Rocco as a nurse.
Would you like to say hi to her?
Do we have to say Dr. Thomas Rocco every time now?
Can we call you Doc? No, can we call you Doc?
I like
Doc's
Doc.
perfect.
All right, I like Doc. All right. So we brought in the Doc today because we've had a doctor on the show, a brain doctor, not a brain surgeon, but doctor. I call him my head doctor, right? Told me about the, what was that? What
Dr.
do I do?
Kevin Chapman?
Yeah, but what do I do on the golf course?
Oh, you visualize.
Visualization techniques.
So, Doc, you're gonna understand pretty soon. This usually is all about us and how we can improve our life.
You didn't even need to come. So we did want to bring in a doc though because you've got a cool background and you also have a podcast, right?
I do.
And what do you talk about on the podcast?
It's called Cbd Health Podcast.
Okay.
I do it once. I used to do it like once every couple of months. I first started just sitting down talking about CBD, about medical marijuana. And then lately, it's kind of interesting. I've gotten a lot of companies contact me because they want to be on my podcast. So I've had a couple of places, one in Kentucky, a guy out in Michigan about selling, growing, and I've done a handful of podcasts. People come to ask me to be on the podcast to promote their stuff. I'll be honest with you, nobody listens to it.
They knew that you were coming on.
There's
here.
two more that
they're trying to get you.
Seriously, I get I don't know how you guys do the numbers, but I like to look at it. I get maybe 20 hits a day at the most.
It's a good number. It's a good number.
I think it's the same 20 people.
We look for a couple commas. We did a new thing on Reels on the Instagram. We've been screwing this Instagram up thing for I don't know a year.
Max was supposed to be the expert on this.
Max was supposed to be the expert, and we started doing stories and Instagram posts, and we get pretty decent views, pretty decent traffic on it. We put up a reel yesterday for the first time. 3,000 people saw it within 2 minutes.
Nice.
So are we doing something right with that, Max?
One follower at a time.
All the rest so far, not so good.
No, we did one that was almost like 700 or 800.
Yeah, we're pushing there.
Yeah,
I didn't really know about it. Then you showed me the one where we were on my patio.
Yes,
and it's just a cut up or did you slice it out or something like that? Or
I did, and I did that by accident.
All right, so you cut out
with the fart noise.
Yeah, you put a fart noise on.
You didn't hear it? Hang on, Max. I'll play it for you while you wait, Doc. Ready? I put it right here. Hang on, it's coming up. Ready?
Make sure. Yeah, put it in the mic though.
We were on your patio. You can put it in the episode, Max. But it was I guess you can do sound effects, and I clicked it. And then I was listening to it, and I had this huge fart noise, and I was like, that's the perfect timing. I'm leaving it. So that's how we do it. But
if you want, my kids, I got all teenagers. They're on TikTok all the time. It's insane.
So are we. We just watch
things. And it's just, that seems to be the place to be to make social media.
It's quick hit videos like mine.
You can get stuck in there. Some of the shit is funny.
Right.
I mean, my wife will sit there at night and watch some things and just giggling to herself or laughing, and then she shows me, and then next thing you know, 20 minutes goes by, and it's just like some of that stuff is funny.
Most of our text thread, I would say once a day, we're both sending each other one thing.
Right.
Yeah,
From TikTok.
I'm more
It's
of the
pretty fun.
Instagram, like sending like a funny thing or a golf tip even. It's
Yeah,
just,
you are an Instagram
just
guy.
trying
But
to
I, mean, I have
figure it out.
I have one son, a senior, one's in college. One of their friends graduated high school. All he does is TikTok. He makes money off of TikTok.
Right.
Yeah.
So I asked him, will you promote what I'm doing, the CBD website? He says, he goes, my kid, the people that watch me are like 8 years old.
Really?
And that's all he does. And he's got, I don't know how, I can't believe how many people follow him. And that's what he does for a living.
Do you watch any of that stuff, or do you
little
go on?
bit.
Because
A little
it's
bit.
got to be bad for you, right?
Oh, it's awful.
Awful.
It's the
right?
opening. You
It's
know
a
what it
waste.
is, Mike?
It's a waste
we
of
have younger
waste
kids.
of time.
Waste
But
of
what does
time.
it do? What does it do in your
Waste of
brain?
time.
It's got to do
gotta
something to
chew
your
it up.
brain.
There's a great skit this past weekend, Saturday Night Live. It's a TikTok spoof where a mother like texts the kid and says, you know, are you studying? And she's like, oh yeah. And it just shows you what the kids do on the phone and going through TikTok and all the crappy shit that they're watching.
Yeah.
And then you find out later that like the person's studying for the LSATs and just the waste of time. But it's the things that were on it and the spoofs that Saturday Night Live that are doing it. It's hilarious.
Right.
Yeah, don't
But it's
pull up
what
your
a waste of time.
don't pull up your time app thing on the
no.
phone.
Oh, I
No, I don't even want to know.
no. Do you?
It's
do you,
not good.
Do, what is that? Screen
time.
Screen time. So the screen time.
Sunday
I was
morning is the
Do
worst.
you want to turn this on? Nope, absolutely not.
My
I don't.
funny one that I do is like TikTok is like I'm like, 22 minutes of TikTok. I guess that's how long it took me to take a shit today. It's like the perfect amount of time. Yeah. So that we talked about we're going to go more
go
down
down-
that
yeah, sure.
because I think there's a lot that Dan and I have for questions. Being a former NFL player, former MILB player, right? Like we have a lot of time and our bodies are pretty beat up, and we don't understand how this all works. Actually, to tell the truth, because we were coming out of it probably when we needed it. Like CBD in general, and we get to a point where we're more comfortable in life now, and now it's like massive, right? And it's like,
It's massive.
yeah,
And the golfers now are
right.
chewing it while they're playing it.
Chewing it,
Right.
the creams and that stuff, and we're
gonna go there
down
more.
there because it wasn't as accepted
right.
years ago.
Right now, it's pretty much legal everywhere. So, but we do have some bones to pick though first, and that's not a pun on being a spinal surgeon.
I'm actually
right?
a general surgeon that works for an orthopedic group.
Got it. So, where do you traditionally do your surgeries on? Is it orthopedic?
Or is it
as in
general?
Knees, elbows, shoulders.
So my background is I'm a general surgeon, which is pretty much from the diaphragm down, talking about hernias, appendicitis, gallbladder operations, cancer of the colon. Those are the main things. And I'm doing like a handful of things. So now I'm the medical director of the wound clinic at Newport Hospital. I'm there twice a week. I work with this group, Ortho Rhode Island, in Warwick, which I do spine injections, and that's 3 days a week. So what I'm doing is I'm working with the neurosurgeons. We're trying to get people not to have surgery.
Okay.
Just doing your cortisone injection. You have an X-ray over the area.
So you're just
Get around-
greasing the skin in there a little
Right.
bit so
Get
it
rid of
doesn't.
Delay. So
That's right.
most people say, well, I'm young, I'll have my surgery now. But if you had your surgery now, 10 years from now, you're going to see me again with an injection around around your surgery because you always need your back. Whereas as a general surgeon, you take out an appendix, you don't need your appendix. You're going to live without it. You don't need your gallbladder. So I do those two things. I also do hospice down in Portsmouth. I'm a medical director for that. How I got into CBD is I work with the Department of Health with medical marijuana licensing, and it's really very legitimate. We do everything by the Department of Health. We have a license with them. We work with them, and that's how I got into CBD because I've been doing that since 2010, and about 3 years ago, it wasn't people would call not about THC, they'd be calling about CBD. So we started a website. I was hoping this website would be great because it's a doctor run. We're talking about dosing, what to use it for, and honestly, only patients of mine are the ones that contact me because they know who I am, they trust me, and then we just kind of work with the right dose, the right type of CBD. And then if that doesn't work, then sometimes we move on to getting a medical marijuana license.
So THC and CBD, what's the difference?
That's a great question, Dan, because
Right.
I was thinking
Thank you.
the same thing.
Great
question.
It's on.
I've known these 3 letters
It's
for a
on the
while
packet.
now, but
It's on the packet.
It's on the
I know
packet.
that one
one-
one puts you in space.
Right.
It depends which one.
Right, exactly.
Right. Okay.
So THC is the psychoactive part of the marijuana plant. CBD comes from like the hemp plant, which is kind of the cousin of the marijuana plant. The reason why
It's not the same plant?
it's different. It really
Okay.
is different. You can get strains of marijuana plants with CBD in it, but when you think about making CBD, it's usually a hemp plant that's mainly CBD. But you can grow a marijuana plant that has a combination of the two, and they call it a hybrid. But this essentially what THC and CBD are. They're the same thing. They're cannabinoids, meaning that they're from the marijuana plant. The reason why, it's really simple. The reason why THC is psychoactive and gives you high and CBD doesn't is because THC works at the receptors of this endocannabinoid system, which are mainly in the brain. They're CB1 receptors. And so it binds to it. So when it binds to your brain, you get that psychoactive effect.
Which is not the calming effect, right?
It's just that high. That's
The high, the high effect.
And there's
Okay.
different strains that give you different kind of highs with THC. So it's binding to it. So you're not allowing your brain to work normally.
Pick a cool name for a strain. Do you have a cool name for one?
We were just looking at like purple haze. You know?
Sounds
Girl
like
Scout-
What would you pick?
Girl-
What would you pick
apparently,
for a
Girl
name?
Scout cookies.
Purple
really,
Haze.
Yeah.
I mean,
What would you pick
that's
for
all
a
Jimi
name?
Hendrix, right?
Yeah. Would you have a good name off the top of your head?
What was your?
The name for my horse?
What is it? Motor guy or something like that. Great. Like, remember we were in that meeting or something like that?
Yeah, Clubhouse guy.
Yeah, Clubhouse guy.
would be a good one. All right, I'll think of one in a little bit. One will pop to my head. So there's different names.
Well, they
Yeah.
like this Gorilla Glue. It's really strong. Girl Scout cookie. They have all these different names for different types of THC products. So it binds to these receptors. So it's not working normally, and you're getting like that high. CBD works at the same receptor level, but instead of binding to it, it makes it work better. And those receptors help with inflammation. So it's allowing that receptor to work properly rather than what THC does. So THC binds to it, now it's not acting normally and you're getting that high. What's really interesting is when somebody, say, takes too much THC, you see in the movies, they're eating brownies and they're kind of off the wall.
Yep.
The best way to take care of that the quickest, other than time, is actually taking a CBD product because they work at the same receptors, and the CBD is almost the antidote to the THC.
So it's like the Narcan
It is.
to
It really
the
So,
overdose.
so if you get really high, take CBD to bring you down. Is that what I just heard?
Exactly.
we do.
All right.
We do have a
All right.
doctor. There is a doctor on
Okay.
set
True.
today.
All right. I'm just
Okay.
So that's,
all right.
that's why when you talk about
Yeah.
medical marijuana, like if you just take you go to the dispensary and they give you something that's purely THC, it's recreational. If you really want medicinal effect, it's called the hybrid. You want THC and you want some CBD in it, so you're getting the effect of the medicinal part of it without getting so much high from it.
Did you get into this because of you were trying to prolong those people from getting surgeries? Is that what, like, sort of?
Oh, the whole getting into medical
Yeah. I mean, you said
marijuana?
2010 you got into it with the health board. Or you know,
So what happened? This is what happened was I do a whole bunch of things every hospice and general surgery and pain injections. There's a group in Warwick that needed a doctor to do licensing for patients, and it's called B&B. And the two B's, one of the B's is one of my patients, and he called me up and he said, "Listen, I need a doctor. This place is going to go out of business. The doctor that was here had to move." And I said to him, I go, "Pete, I cannot. I got so many jobs. I don't have time.
right.
I just don't. I got three jobs. My wife's a surgeon. She's on call too. We got 4 kids. I coach, every sport with my kids." And he said, "I'm sorry." The other B, who is Bill Cotton, who runs B&B with his wife, he calls me up. He goes, "Give me 10 minutes. All I want is 10 minutes." I still remember this. It was on a Thursday. I said I got from 12:15 to 12:30. And in those 15 minutes, he convinced me to do this. So the reason is because he wasn't just opening up a business to make people get licenses and take money. He was doing it all the right way. In the meantime, while he wanted to start this business, he was getting a license with the Department of Health to say, we want to be regulated. We want you to come in, check our charts, do everything right. So we have great communication with them. We're the only practice that actually has like a license with the Department of Health to do medical marijuana licensing, not only in the state, but in the whole country. So we're kind of like the trailblazer. And we got the license. It took us about 3 years to get it, but we're really very legitimate. And that's how I got into medical marijuana.
Okay.
Just kind of fell backwards into it, which I truly enjoy knowing about this because I don't like giving out narcotics.
Right.
All narcotics do is they don't fix the pain, they just mask the pain. So narcotics are good for two things. You just had surgery, your pain's going to get better because you're going to heal. And like I do in hospice, end of life. There's no other good reason for it. And that's where people will say, I need a script.
What's the definition of a narcotic? Like, what is narcotic? Like, you've been saying some things that make sense. THC hits this part of the brain. CBD hits this part of the brain.
So narcotics are like Vicodin, Percocet, even Tylenol, codeine, Tramadol. People don't think it's a narcotic. It is. Dilaudid is a really strong narcotic. So if you're taking, say, 1 milligram of Dilaudid and 5 milligrams of morphine, that 1 milligram of Dilaudid is actually stronger than the 5 milligrams of morphine. I think it's about 10-to-1 ratio.
And your thing is you didn't like to give any of that out, so you're finding this other solution,
exactly,
right? Got
exactly.
it. Okay.
Exactly.
It's not just because you like pot.
No. Okay. No. That's not the reason.
I know. I just had to throw that out there, Doc.
But I have
make
to
sure
say,
I understood it.
It's great discussing this at parties. It always comes up.
I'm sure it does. That's why it came up.
If you actually, I think, Google Pot Doc Rhode Island, I think my name pops up.
That's it.
So.
That's a perfect website for you. That's great. So, is this the Wild West still out there right now? Because you said you guys are the only one that's like certified the way that you said it, like your practice. But I mean, just in general. Medicinal places, recreational places, states saying, hey, we're open, we're not open, whatever it is. Right. Is it still the Wild West? Are people still figuring this out? Or is it kind of like settling in? Where
it's definitely settling in terms of knowing different strains work for different issues. But this is the problem with it. We don't have really good clinical studies on this because marijuana is considered a Schedule I drug. What's a Schedule I drug? Narcotics, like we talked about, is actually not a Schedule I drug. It's a Schedule II drug. That means it's a drug that can have addictive properties but has medicinal effect. So narcotics, there's studies on narcotics. But like LSD, cocaine, marijuana, street drugs, they're Schedule I. So they're not, the federal government's not allow studies
they're saying
on a street drug.
marijuana is still Schedule I drug.
I.
So it's like the egg in the pan.
Exactly.
Don't do drugs. This is your brain. This is your brain on drugs. They're still thinking marijuana in that.
Yep. So there's no grants out there for studies on THC and even CBD.
But you said the Schedule II, like narcotics and all that stuff, is that like just because it's a pain?
It's a pain pill, right?
So medically, after surgery, you can use it then.
Right,
okay.
Right, exactly.
Okay.
So it's a Wild West in that we don't. A lot of everything is anecdotal. It's not. It's not really trialed well at this point. But I think if marijuana becomes a Schedule II drug, then it's going to be a Wild West for pharmacies.
They'll sell it at CVS, right?
Yeah. Oh my God.
Yeah.
Well, I would try to find the company that's going to make, like, grow, not synthetic, but grow the natural marijuana.
An actual company,
I would
like
put tons of money.
Walgreens.
I would put tons of money in that, like if it's Pfizer.
Walmart.
Yeah. Oh, yeah. So it could be like, you're saying it could be an actual drug company.
It's going to be a pharmaceutical company that's going to grow it, and then it's going to put it on the shelves at the pharmacy.
Well, why can you get CBD at the gas station?
Right.
So what
is there different levels of that? Is that
why? The reason why you get CBD at the drugstore or the gas station, it's because now states are allowing that. Most states allow CBD oil being sold like recreational. Tomorrow I'm talking to a group that's growing marijuana in Tennessee. So I kind of looked up, like, what's the Tennessee laws?
Yeah.
Their laws are marijuana is not decriminalized, which means, like in this state, it's decriminalized. Meaning if you're found with it and it's less than an ounce, you just get a fine. No big deal. In Tennessee, there's no marijuana laws at all, so it's totally illegal. But
that makes sense. They could still marry your cousin there too.
Right,
I think.
exactly.
So, it's never, I'm off the wall today, Dan. Right?
You are. It must
You
be
said
the
you
topic.
lost your voice earlier.
But CBD is technically, legal. In most states, CBD is legal, even though it's part of the hemp plant.
Do they keep kind of like just categorize it like a Tylenol or an Advil or just like an anti-inflammatory type thing?
If you look at the FDA, it's considered a supplement.
Okay.
So what a supplement
like a
means
GNC,
it's like a supplement. The FDA says it's okay as a supplement, but we're not really regulating it. There might be issues with it.
Right.
That's part of what CBD is right
That's why
now.
Castle's down there. That's why Castle's down.
That was the whole
Tennessee.
thing. Like, I mean, and it's just becoming accepted now. And what are the current? Do you know the current rules in like the NFL and MLB on what they're doing? Like, is pot legal yet?
So it's funny you say that.
No, it changes. It
does change.
Now I will tell you, and I have stories on this. I'm sure you do. When I got drafted by Houston, it was right when Major League Baseball was cracking down hard on steroids. Right? It was after the McGuire Sosa. Like everybody was starting to really crack down, but they weren't cracking down on it at the major league level because they knew that probably 75% of the league was on some type of antibiotic, anabolic steroid, right? Antibiotic. I'm on antibiotics. So anabolic steroid. So they really started testing at the minor league level so they could almost wean it out of the game over time. So by the time guys got there, like you weren't relying on anything and you were there on your natural talent. Now, what was happening? So I was drug tested all the time. Literally, like show up on the road, go to the hotel, end up getting to the field, boom, piss test. Can't go on the field until you piss, right? So, and that was, I would bet 8 to 10 times a year, maybe even more. Guys weren't worried about much about like steroids, but people would panic because if you had a marijuana positive, it was 50 games or 30 games. I think it was 30 games.
Whichever.
First time. First time you had to do the like 2 weeks of like, talking to somebody about it, and then it was like a 30-game suspension. That's marijuana, right? Like guys would smoke all the time and then drink like some Mountain Dew looking drink and then hopefully piss clean, I guess. I don't know. I wasn't a big smoking guy, but like that was a constant theme. Right now, I cannot imagine that is still a thing.
It can't be.
I
can't.
So I was talking to a minor league hockey player for Providence Bruins a couple years ago, and he wanted to get a
Josh
license.
Hennessy?
No, it wasn't.
That would have been 20 years ago.
No, that was only a couple years ago. He's
like
young.
2 or 3 years ago, and so he wanted a license. And I asked him about drug testing, and he said it's got to be like you almost smoked it as you're peeing to have a problem. He's like, there was different. They really didn't care about it.
And that's all happened recently, though. What about you? Was that a test?
It was, and you basically knew, and I knew guys that smoked a lot, and I wasn't a big smoker or anything like that, so it didn't really bother me. But what they would do was, and I don't know how it is now, but when you showed up in the off-season program or for minicamp, it was basically minicamp. It was one test for street drugs a year. And if you got popped during that one test, you were in the program forever, however long it was, a year, 2, 6 months, I'm not even sure. And then you'd be subject to random drug tests throughout that period. But if you cleared that one drug test, either at minicamp or if you didn't get it at minicamp, you knew you were getting it the first week of training camp. So guys were pissed if they didn't get it at minicamp. Like, God damn it, now I got to wait till August or whatever it was.
Yep.
And if they got through that one, they were good. But if you got popped, then you were in the program.
That's what we call it too.
Yeah.
It was like you weren't necessarily suspended yet, but you were in the program. You were like, you had the label, you smoked, right? You had to do the therapy part of it, right? And
but
then
still,
if you
it's
get dinged
just
again,
like then it goes back to the person. Like you know when the drug test is coming, and if you don't get it now, you know when it's coming again. How the hell do you fail that thing?
Yeah.
And the only thing with THC, it might stay in your body for a while.
Right, you got You got to. It's a piss test, so it might be a month or hair 2 or whatever. They didn't do hair tests. No. They weren't that in depth. But You know,
we did.
You know
We
it's
pissed, like,
coming
in an
up. It's like,
actual
hey,
cup, like a
it's time to
Dixie cup.
cut it off now. Just don't do it for a little bit, and you'll be fine. But some guys didn't do it.
And what they didn't really understand too is like with baseball, the thing that guys were doing up in the big leagues, like that time and then further, was HGH, and that's a blood test. So you can test all those guys all you want.
Right.
They were taking HGH. It's $10,000 a month. Like they were. Like I'll take a piss test.
There's
no
always
problem.
someone smarter figuring
Right.
out something and how to beat the test. And
Right.
I don't think steroids were antibiotic.
Anybody.
You know,
Bullshit. You're saying NFL?
I don't think steroids were as much of a problem. I think HGH, when they couldn't test for it, and
HGH.
the NFL at that time didn't have a test for it. I'm sure they have something now that they're doing, but it wasn't spoken of, and I never saw like needles going in or pills or whatever. And I never saw that in college. Yeah, there was probably a couple guys that they put on a little bit of weight and a little bit of strength in the offseason, but it wasn't prevalent. I mean, not prevalent. What's the word? Widespread.
Prevalent.
It really
Nice
wasn't
word.
widespread.
You looked at me when you said put on a little weight. You did.
No, I didn't.
Yes,
No, I
you
didn't.
did.
I'm
You
being
looked
nice
at-
to you now.
You
lately.
did this thing.
We got white sweatshirts on. We're good.
By the way, you call this T-shirt guys, so we wore sweatshirts just to get you. That's what Max said. He said we're the T-shirt guys. So
So
we're
I think HGH was probably that new thing where you couldn't test, and I think that was definitely around, but it wasn't spoken of.
I'm not an expert at HGH, but it's not like an anabolic steroid. What I know about it, it makes you just
Right.
But
it
you
makes
recover lightning
You recover fast,
so you can work
it's not
out.
making you hit the ball farther.
No, but you work out
but
hard.
it's
You can work
definitely-
out harder
like
without any type. Like, okay, I'm gonna go crush legs today, and then I'm gonna crush upper body and back, and then I'm gonna wake up in the morning and do it all over again, and I feel like $1 million.
By the way, Tip's looking for a little script
by
of
the way,
that.
hang on, how many pads did you bring?
No, back to
it's
the
all the pads right
back
here.
to
Just
the-
sitting
it's all
there.
on the phone now.
Exactly.
Okay.
back to the THC and the CBD though. What did happen was pills, right? And what you're talking about, masking the pain, and that's exactly what it was doing. So I
Yes.
don't really have a problem with using that type of substance in controlled with your trainer, with your doctor, or something like that, especially for a guy after a game or something like that.
I
because
think marijuana
I
would be
would get
perfect for football.
I would get scripts. And after
Yeah.
a game or
Oh, me
midway
too.
through the season, it's like you're beat down. It's just like I just want to go to bed tonight.
Well, we've talked about this. We lived on Celebrex.
No, I didn't take Celebrex.
Oh, you weren't on
A
Celebrex?
roommate of mine did, and didn't they pull that off the market?
did.
No, you can't even. I took it for 2 years
it's
after
bad.
I surgery.
It's bad.
Like every day,
Bad
2
shit.
pills.
Yeah,
like,
I never
and it was.
took.
By the way, it was like
I took Tordal.
Yeah,
okay,
Toro,
but that's what we
Toro.
talked. That's what we
that's
talked
tough
about.
on your. Both of those are tough on your stomach.
Right.
I got an iron
Yeah.
stomach.
Good
doc.
thing I do too.
Yeah, I got an iron.
Throw that shit right in.
But I remember when I first was taking Celebrex. It was after my surgery. I didn't need it. I didn't need much, and I don't like the feeling of drugs anyway. So when I'm on something and I feel like I have like tunnel vision or something, I'm like, I don't like this. Even like NyQuil or Dayquil. I'm like, oh, I hate this. But after my surgery and I came back, it was a year later, I started to play again. Like if I had inflammation, they didn't want me taking like 1 million ibuprofen all the time. So they're like, let's just put you on Celebrex. And I will tell you, it did work.
Yeah.
It made like inflammation go down drastically.
Maybe you should take some now.
It's not going to help that inflammation.
Yeah, not that inflammation, exactly. But it really did work. But I know, and this is what sucks about playing a professional sport, is like something is going to end up hurting me later. Yeah. Whether it's Celebrex, whether it's tearing your shoulder, whether it's tearing your elbow, like my elbow is going to hurt earlier in my life than a normal human, most likely. Your shoulder or your ankle or whatever's busted,
The left side of my body.
hurts more now than a normal 40-something-year-old, right?
Yes.
So, and that's like part of the risk. But I'm wondering, like with CBD and THC, but CBD primarily, is that what we should be taking after we get done playing? Maybe not during, right? But like after, is that the thing that can calm
I
us
think it
down,
is.
right? And like
Absolutely.
And
I think THC,
calm the body down.
THC, I truly believe really would help you calm yourself down. Like I think after you played a football game, it's 4 hours.
Right.
Your adrenaline's like this. I think that's the perfect thing.
Yeah.
After a game, and It'd be great if like the
Tell
NFL.
you, it's a hell of a lot better than drinking 24 beers.
No, exactly.
Same thing.
No kidding.
Yeah, the dog. Like my game was at 7.
I would-
By the way,
the
his
NFL,
game was
like-
at 1 o'clock. Mine was at 7:05.
I know, right?
So like every night at midnight,
Yeah.
I was at
Right.
peak
Yes.
performance, and I went to bed at like 4. Usually ate it with like 19
What time,
bites.
what time did the game end?
The game ended at 11. It was just like, but you were up,
Right, your adrenaline's
right?
flowing.
Yeah, so like you're saying with
I
him,
would love for like Goodell to like almost promote it.
Right.
Yeah,
I don't
I
understand
think it's
why.
going to
Why wouldn't
it
they?
would get them off the bad shit.
Right, and the only thing that you have to make sure is when you're getting THC, you're getting it from a dispensary.
Mm-hmm.
That's the problem is you're getting it off the street and something's laced with something.
Yeah.
Then you're screwed. And you know, but if you're getting it from a dispensary, somebody shows you what's in it. I think it would be the perfect medication after when your adrenaline's up to here. Like, you know, for me, I played sports in college, but you know, like my experience is playing men's hockey. What do you do after the game? You sit in the
in the locker room and have a couple
drink
beers because you got to calm it down,
right?
Yep.
I mean, you're better off using THC.
This is helpful. This is a great conversation. Good job, Max. This is
doing my job.
This is good stuff. All right.
Wasn't it Chandler Jones that smoked that thing and it was laced with something? He showed up at the police
Yeah, I
station
know, but
and
that
like
was
all naked and all that shit.
Yeah.
So there's your problem,
Right?
right?
Yeah.
That's-
I've said this like probably.
That's what happened.
I've-
It was nothing. He didn't do anything wrong.
But now it's all this fentanyl shit too,
Right,
right?
exactly.
No, and that's
the
what
fentanyl.
I
And
don't
they can lace that
understand.
in anything.
anything. That's
So
how you-
I'm like my kids are 13, 11, and 9 now.
You're starting to
And it's
think
just
about
like
it.
thinking it's just like
Yep.
you like when we were younger, it's like, okay, someone's got a joint or something like that. You're not worried about that stuff. But now it's even the smallest amount of fentanyl laced in there, they could die.
But can you imagine the NFL being sponsored by a dispensary for
might
all
happen.
the teams? How much advertisement and money it would be insane,
Right.
And you're getting it from a reputable place, growing it correctly, clean.
And
Like,
treating
are
the
people-
players the
This
right
is my
way.
question. This shows you how I'm not really.
I want to be involved with this. I don't know how I.
Okay, I'm not really. I'm not. This shows you how I'm not really a weed guy.
Doesn't
Or,
Doc
I'm
look
not a
like Jim
weed guy.
Haslett a little bit?
somebody?
Jim Haslett? Remember the old Saints coach?
Yes. When he walked in, I actually thought when he walked in, I thought it was Nate Lehman for a second. I was like,
Jim Haslett, Nate. Yeah, okay.
So, to people, and this goes to like I don't really know. Why do people use a drug dealer anymore for marijuana?
I know.
Like,
It's-
isn't it? I mean, isn't
It
there
is-
like a place on every corner
it
and
is-
every spot now?
Well,
It's-
there's 3 dispensaries in this state.
that are all medical, though, right?
No, you need a medical license to get into it.
Okay.
But you can go to Massachusetts, and
Yep.
they're all for medicinal or for recreational.
Mm-hmm.
The difference is in Massachusetts, if you have a card, the tax is 0,
Mm-hmm.
and it's like 22% tax if you don't have a card.
So it's just like
So there's no reason to go on the street. The only thing is on the
That's
street,
what I mean.
it is cheaper. It
cheaper
can
on
be-
the street.
It can be
The black
expensive.
market.
Because they're freaking
Yeah.
cutting
I
it
have
with,
to- I have-
cutting it with other
right.
shit.
So I'm gonna
that's the
tell
thing.
you,
Yeah,
that-
they're doing
that's-
it. Yeah, I just watched Blow the other night, and I was like, these sons of bitches. This is how they were making all the money. It was all fake. And the whole room has the cash in it.
Entrepreneurs.
Yeah,
But
entrepreneurs.
the biggest complaint of patients is when they go in, it's expensive, but it's
Yeah.
clean and it's safe.
Yeah, you
and-
don't have to worry about
Or-
it. That's got to give
Yeah,
you peace of
that's-
mind. It's like, you know what I mean? It's
crazy to me.
It's like
Yeah.
you're willing to pay for the better product.
Right.
Right.
I just said a product.
Exactly.
Jesus Christ.
Now, why would somebody? Okay, let's go CBD only.
Yep.
Right. Why would somebody buy CBD at the Shell station compared to a dispensary or something like that? Is there a difference? Is there a potency level that's different? Should you stick to a certain potency?
The problem with CBD is so much white noise that everybody's trying to sell it.
Yep.
And you really should get it from somewhere that. So when you get it at the gas station, that guy bought it from somebody.
Yeah.
Who's selling them cigarettes and soda.
Yeah.
And they don't know where it's coming
Right.
from, and just stick it on the stock, and it is what it is. You don't know what you're getting.
Yep.
So for my website, we have like 3 or 4 companies. So if you want to know exactly what's in it,
Yep.
we can give you the results. And so you know it's a reputable CBD. You don't know where it's coming from. And the other thing is you don't know the right dosing. It just says CBD. It's really, you should go somewhere that could give you some information. The website that we have, we're the first retailer in Rhode Island to be licensed. And all that means is we can show the product information. If there's a problem, we have a recall process, and that we're using companies that are reputable. That's pretty much what you need to do. And it just started last October. If you're selling CBD in Rhode Island, you need to get this license or else you can't sell it.
Okay.
And they're giving, a little, some time for everybody to get it done. But that I think would put gas stations out of business because they're not going to go through that recall process.
Right. Yeah.
Well, and then
But it's getting it from the right companies. The problem is everybody's growing it. It's getting the right company who makes it well. For me, I like the 3 or 4 companies we're using because we get good results with our patients.
What's the difference between a medicinal facility and a recreational? Is there anything different?
So
in the,
you need the
know,
card, right?
No, I know you need the card.
talking
but like
you're
just
talking
in
in
general,
there
with
product-wise.
There
There's
isn't.
nothing.
Like, so in Massachusetts, you walk in, you have the card, it's 0% tax.
Okay, it's
without
just a
the
tax
card.
thing.
Got
In
it.
Rhode Island, it's only medicinal.
You can only
They are
only get it with a card in Rhode Island.
in
is what
Rhode
you're
Island.
saying.
They're going
Got
to
it.
go recreational, still working on the foundation. They don't have enough. They don't have enough dispensaries here. They only have 3. They need like 10 more before they go
It
recreational.
also takes a lot longer for things to get done in Rhode Island.
It's
It's
just
just
insane.
that
They haven't figured out whose hand's under the table yet. They'll figure that out soon.
I know.
Yeah. So with 2 guys, we're 250 pounds ish.
Right.
Dan's heavier than that, but I might be in that range too.
I'm not. I'm. You know, I'm.
So we
whatever.
sit down. Say we've never taken CBD.
Right.
Never had it. Right. I'm saying hypothetically, we've never had it. Right. Would we want to have a doctor present the first time we take one? Would we want to,
No.
like...
You're not
would
gonna
we-
get high or
No, but
anything
would
like
we
that.
want to take one? Do we want to take a certain milligram amount? Like, how would it work?
So that's what I try to do is when somebody gets it from us.
Yep.
I usually has instructions, but I usually tell people just call me because
Mm-hmm.
you want to know what you need for what issues. So THC.
Yep.
If you've never really used it before, you shouldn't do more than 2.5, 5 milligrams at a time. People have done pot all their lives, can do 20, 30 milligrams, no problems with edibles. But you start at like 2.5 and 5 milligrams. So if people hear that and they think CBD is the same dose,
Yep.
it's way too low. Like 5 milligrams is for your little puppy.
Got
that
it.
needs it for
Got it.
anxiety.
That's what I'm getting
By the
at
way, I
here.
could
It's
use
like-
that for my dog.
Yeah, it works
He is
great
Yeah,
for
it's like
dogs.
a
fucking nuts.
melatonin
He works
tab.
nuts.
It
I got
works
melatonin
great
gummies.
for dogs.
Yeah.
I might. Yeah.
Does it work?
I might just.
Do you give it to dogs?
So this is what
This is a great idea.
I think-
Is this a company we just created?
No,
No,
we
it's
haven't.
still-
we
it's
haven't.
out there.
No.
It's out there.
My cousin's a vet in New York. She's not married. She loves her pets. She's the most conservative person in the world. I sent her a batch of CBD as a joke, and I thought she was just going to throw it out. So she's got about 12 or 13 like clinic dogs running around the place. She called me up like 2 weeks later, says, "You got to send me more of that stuff. All these dogs are so much calmer. I can't believe it works." So now
is a
she
great
sells
idea.
it out there for, and it
1000%.
works great. And
Throw
again, it
one of
works.
them in the
So-
food, and then
Right, you throw it in the food, you put oil in the food, and it
Yeah,
depends on the
oil,
dose has to
okay.
do on the
Oh,
weight of the dog. Like, so if it's a little dog, you use like 2.5, 5 milligrams. If it's a dog that's like 100 pounds, you need like, 10 to 15 milligrams. So for adults,
so what you're saying is we need like 45 milligrams.
you need 45 milligrams.
How much do you
50
need for
milligrams.
a dog that is 23 pounds?
It's about 2.5, 5 milligrams.
Because the other one that's 23 pounds doesn't move.
Get Dan's laptop. He's got to get on the dock site and start ordering. He's got to
So
get
the one that
shipment in.
doesn't move, is it an older dog?
No, the one's 6 and the other's 5.
Sometimes they don't move. They're in
Both the
pain,
same-
and you give them the medicine, they feel better.
Both the same breed.
Oh, that's
Yeah.
an interesting, Doc. That could be the case.
What's that?
What
He's in
one-
pain.
What one's hurt?
I don't think he's in pain.
Yeah.
No, he's actually.
Bowen?
No, he's not in pain.
Okay.
I'll get
trying
you
to
some
think.
stuff. I don't have any dog stuff, but
Is it different? Is there like a
gotta be
dog
the same
CBD?
thing.
Well,
or-
the dog stuff you might like. It's bacon flavored.
Oh yeah.
Give those
Bacon.
to
Who doesn't like
peanut
bacon?
butter.
Yeah, my dog's name is Dan.
You can put bacon on anything. Yes. His last name Cope. Get that card.
Dan and Tip, get over here, dogs. Exactly. Okay, so
So
we're gonna-
dosing is different for adults. So like for anxiety, it's like 20 milligrams.
Okay, so I need like
but
80.
the weight,
Maybe you can get off that other thing and then
Oh,
lose
yeah,
your
we're
weight.
gonna try this. I know.
But,
That's what I might try.
but for pain, it's severity and weight.
Okay.
So I'm about 170 pounds. I need like 30 milligrams. You're over like 250. You think about 50 milligrams.
You trying to gain some weight, Doc? Come on in
No.
here. Have lunch with the boys.
I know, right?
We'll
Too
get you-
busy to eat.
We'll get you up to 195 quick. That'll be no problem.
I've changed today. It's like a new year
You did.
today for me.
You had eggs.
It's a
you
new
had
year.
2 eggs. This morning. You had
I
a
had
tuna
a
packet.
tuna packet.
It
There
worked
you go.
out.
I'm just, summer's coming. I'm
the
trying to get into. It's not about
You feel better.
That's what it is.
That's right.
You
Right
feel
now
better.
we're walking around with a 25-pound dumbbell that we don't want to have. Right?
Yes,
That's a
1,000. And do you ever see
grab a
that
25-pound dumbbell and then throw it on the floor and be like, that was on my body.
And you
That's
see
what
the
gotta
picture of like 10 pounds of muscle versus 10 pounds of fat.
Right.
Makes you throw up.
It
I know.
does.
So and I don't even care about the weight. The weight doesn't matter.
I feel better.
I was
I don't care about a number.
I don't.
It's how the clothes fit. It's how the whole thing.
300 pounds before. I've been bigger and all that stuff. I don't. The number's not important, but and then you get on the kick. Like this guy may be the most obsessive guy you've ever met in your life.
I'm going to be pounding CBD pills.
So like we'll get on a Peloton kick and it's all Peloton and Peloton.
right.
And my wife always tells me like you got to lift some weights and you got to lift some weights and all that stuff. And
By the way, when we
You
did that
do-
Peloton challenge show,
you do skinny.
we shredded.
You shred
weight.
down.
That was
you
as
shred
good as we've
down,
ever looked.
But you still get that skinny fat feeling, like you're still
I
walking
agree.
around and jiggling, and it's not good.
I agree.
So, and I heard this on Rogan's podcast the other day. Resistance training, right, and weights. How beneficial is that for people getting older in years?
That's what you want to do. Low impact exercise. That's what you want. You want resistance.
But you want resistance, right?
Yeah.
It is
Definitely.
good for.
It's good for you. You don't want high, like, what you did when you were younger. You don't want to do any of that.
So I don't want to go 1 rep max.
No.
Okay.
Not at all. You want low impact, resistant exercise is the way to do it.
Pliability. You want to be TB12?
No. But you need some.
Need some weight. No, but like put some resistance on there.
Little bands.
Yeah. No, heavy bands. Heavy
You just
band
said you don't want to go heavy.
I like heavy.
You want to go heavy. You don't want to go heavy.
You want to bulk up some more?
That's what it is, unless you want to bulk up.
I don't want to bulk up, but weights
Lighter weights.
are important for
I agree.
putting off. I mean,
Right.
putting
I agree.
off the inevitable.
But by the way, when you lift a little bit of weight and you're moving around, you look in the mirror, you just feel a little tighter. Like a good tight.
Feel better about yourself.
That's right.
So it's funny you mentioned Joe Rogan, because one of my podcasts is, not that I'm pissed at Joe Rogan, but he promotes CBD MD. Mm-hmm. So somehow I got in touch with the CBD MD person, and I'm not sure how it happened, but the reason why I was calling him was I was trying to get involved with CBD MD because I figured there was doctors involved. Because that's what I really want to do is educate and make sure people are getting the right stuff and the right dose. And I said, CBD MD. I go, I'm a doctor. How do I get involved? Like there must be some doctors involved. It sounds like, you have a bunch of doctors. They're deciding what's good and bad. He goes, MD doesn't sound, for doctor. It's for manufactured domestically.
Oh, Jesus.
So it's
It's
and
like
if you
saying-
look at the fine print, that's what it is. Like
It's tricking the
what
consumer.
you just tricked everybody.
Yeah.
And so Joe Rogan's like, I love CBDMD, and I was.
Well, they gave
and I
him a
said,
boatload of cash.
Oh, I'm sure
Doc,
that too.
you're leading me in. You're leading me
killing
into
me.
my.
It's like that was killing me. So I did a
Well, I'm
podcast.
glad you said it, because now
I did a
everybody-
podcast for like 10 minutes. Just I thought maybe he would say something or maybe reach out to me.
Now we're
Never
20
happened.
listeners know
There
MD's
you go.
full
Exactly.
of
You're
He
leading
is.
me into my number one biggest scam that I've always wanted to talk about on this podcast. So thank you for this because
Okay.
I forgot
More
about it.
scams.
This is it. Not that you're a scam. This is a scam. I've always thought CBD MD, right?
Right,
You just
yeah.
said it. You
Yep.
would think CBD doctor,
Right,
right?
yes.
Okay. Here's the company name. You ready for this?
Yes.
You have a produce company, right? Like, make tomatoes and you sell to restaurants. You call it farm to table.
There's got to be one called like
I'm
that.
pretty sure is there.
No. What I'm telling you is that the things are not farm to table. They're made in labs. They're made in they're in Mexico.
Farm with a pH.
Like, yeah, it's a fake tomato, but it's not like a organically grown tomato. It's just a regular old tomato.
So there's a company that does this but
No.
grows it?
No, you call the company farm to table.
There's got to
then-
be a company.
So then what you do
see
is
what
you
you're doing.
You sell them a shitty head of lettuce and an old dumpy ass tomato and blueberries that came from like some lab instead of like right in the fields of Maine. But you call it farm to table and then you put stickers on the door. You're like, you're a certified farm to table restaurant,
Certified.
right? But all that means is you're buying vegetables and produce from my company called Farm to Table. There's another one that you could do called Fresh Off the Dock.
So is that one of your strain names too?
Farm to Table, that'd be a good one.
Table's a good one.
Yeah, fresh off the dock, you could be a seafood company, and when somebody says like, "What's the fish today? Where'd the fish come from? How when did you get your fish in?" And like the person's ordering the restaurant, it's fresh off the dock, right?
There you go.
Two pretty good ones.
I'm just saying.
I had a feeling about that CBDMD thing.
Yeah.
I always wanted. I was trying to. When you were saying it, I was like, I wonder
And
what
that
MD
came
is.
up because I was involved with Hemp Meds. They wanted to do a kind of a a conglomerate of people, like physiatrists, physicians, PT, OT, and we had one meeting by Zoom right when COVID started, and they just wanted to be like the place where people would ask questions and get information. And I got involved. This is the best. This is what I always wanted to do, and it never happened because of COVID. And then CBD MD kind of reached out to me a couple of months later, and I thought, well, maybe I can get involved with them.
What was it again? Manufacturer direct? Manufacturer?
Domestically.
Domestic, yeah.
And if you can find it somewhere in the website, it says it somewhere. Like tiny,
that's
like fine print in the corner.
Yeah, that's good. It's like an onomatopoeia or something like that, right, Max? Remember when we said that word and we never knew what it meant? Yep. But yeah, that's right. I have another thing. I have a bone to pick with you again. I'm going to say that. I use that pun twice now. You said, or Max said, you do something with the spine, right?
Right.
Spinal pain?
I do cortisone injections.
He greases them.
This is it. We're going to talk about. I wrote down cortisone too. We got to talk about cortisone.
By the way,
how many cortisone shots have you had?
That's a big needle.
How many have you had?
I actually have not had a cortisone shot.
You've never had one?
Nope.
Good for you. I can't believe
No way.
Never had a cortisone shot.
What kind of shots did you have?
Well, you see that needle coming. I'm like, I'm all set.
And you grind that thing on the bone too.
No,
Why
you
do they do
don't.
that?
You
Or they
don't.
wiggle it around in there.
Well, so I do it by an X-ray.
I know, but
So
like
you
I've had
see
it on my
the spot
shoulder,
and you
my knee.
smoothly
It's
put
like,
it in?
No,
Oh,
but
that's
then
different.
they wiggle it around.
Yeah, when you do those joints, see, they're not using an X-ray. I'm using
it
an X-ray.
hurts.
I
it's
see
like one
the
of the most
spot
painful things that you like. I hate a cortisone shot. So you see an X-ray and you're like,
here's the space. I'm not going to get near the bone.
Okay.
Put it right in the space.
Yeah, but you're going in by the spine.
Right.
what they do about
Were
my
you like
shoulder?
shitting bricks the first time you did it or something? Like,
No.
what if I hit something wrong?
No, he did it on that
Cadaver?
What's that game?
Cadaver, yeah.
Operation.
Operation.
Operation. He's trying on the operation game.
Got to take the funny bone out.
Yeah. So, but why is it so bad on the shoulder and like the knee and the elbow and stuff? That hurts.
And the reason is, with the spinal injection, there's more space there.
Okay.
You have the spinal cord surrounded by the vertebral bodies, and there's space. When you hit like knees and shoulders, there's no space in there because it's like bone on bone.
Yeah, so you feel the
You're
needle
just
go
feeling
smash.
it, and you're right. There's no like nice space to kind of put it into.
Yep.
That's the problem.
Oh, it hurts.
The people that hurt the most for me are the people that have no disc space. So there's really no space to get in. It's almost like bone on bone in the spine. That's where they feel it.
Yeah, that's
But in
painful.
general, they feel the pressure of it, and it's because you have the X-ray. You see the opening, and you put it right in there. You stay away from the bone.
Got it. Okay, leading me to my point here, and we can go deep on this because I could talk about this all day. And I don't know if this is I can't figure this out. Dan and I have both talked about this. I've always used chiropractic health to feel better when I have, I have like a shitty right SI joint. My hip just from pitching is trouble. So like I can
inject those.
Right,
So those will
and it
feel
hurts.
worse
Yeah.
in terms of injection than the spine because it's really getting into a tight space.
Right, and what happens with me, and you've probably heard this today, right? Because if you're doing back stuff, it's like I get this pain that's so pinching down in my lower back. It goes right over the top of my hip, almost right into my balls.
Yep,
It's like
that's it.
It's like right on my sack, and like I'm like Jesus, and like if I have to get in my car, like sometimes I have to like lift my leg up and put it in there because there's no power. Right, I get adjusted. 2 seconds later, I feel fine.
Because they're aligning you.
Is that so? It's a real thing.
It's a real thing. So when I think
Other
of
people have said it's not a real thing.
I went to a chiropractor the whole time.
Not you, but so they are actually
they're
aligning you, or a nerve is moving. Is there pressure coming off something?
They're getting the joint aligned so it's less inflamed.
And so it's real.
It's real.
I totally agree, and I just can't believe when people say that they think it's Max. You didn't say
We had this conversation earlier.
It's people think like, oh, chiropractor. They're a quack. Like that you can get your degree this weekend, right?
No, they know what they're doing.
That's what I think.
So like when I think of when somebody asks me about doing an injection, I go, it's just part of what you need to do.
Yep.
Chiropractors straighten you out.
Okay.
Physical therapists are helping you strengthen around the joints. So if you did all of those, you're going to do much better than just say getting an injection or just getting a chiropractor, straighten you out. All of them do something different. So it's good to do all of those things.
My chiropractor just left Rhode Island because he didn't get vaccinated. Like, he wouldn't get vaccinated, so he left.
What?
And he's amazing too. He's an absolute witch doctor.
I had to fill out an application.
You have to fill out a test, and you have to watch this video to get in there. I went to him for a few years, and literally, absolute weapon.
He's a nut job.
Unbelievable, crazy guy though. Crazy guy. His thing on the wall in front of it was like, I move the bones, God heals them, or something like that. And I was like, whew. All right. First time I went in there, I was like, am I in the right spot?
I don't know, right?
Yeah. And then he did whatever, he did his thing with me, and I was like, wow. And I just, you get in the groove, and he understood my body, and he'd be able to pick it out in like a second and fix it. But I just, then I'll have somebody that's like, you ever like pop your knuckle? Like, that's what that is. It's not helping you at all. And I'm like, well, how do you explain the fact that I cannot move my head right now, and I get adjusted, and 2 minutes later, I can do a cartwheel?
Right. You're inflamed on your joints. He straightens them out. You feel better.
Okay, so you believe in this.
I
I was
totally
wondering
believe
if this is a serious thing.
Like
that
a
Max put in here.
good example is like an athlete, professional athlete.
You're looking at two of them.
They hurt exactly. You hurt your hamstring.
Yeah.
Right, and then you're playing with a hurt hamstring. You hurt something else because you're not aligned. You're favoring one. It happens all the time.
Yep.
All the time.
I got on the chiropractor all the time when I was playing, and I haven't gone since, which I need to go back and. If you have any good ones,
by the way, we need one. My guy's gone.
Would be
if you got a recommendation, drop the name on here. We'll plug him. We'll pay the guy whatever we want.
Said, it's like, oh, your right leg is an inch longer than your left. I'm like, how the fuck did that happen?
Yeah, right.
Like, and you're looking down or whatever. It's like, oh, you're walking funny or something. Like, I don't know, and all that stuff. And then I had a sciatica one time. Couldn't walk for 3 days. Went to the chiropractor. I was like walking the next day.
Yeah, I mean,
it's just like it has to work.
I don't get it because my chiropractor, I would have like t-shirts and a short on. He'd have me go walk down the hall, walk back. He's like, let me guess, SI joint a little tight, and then left elbow hurting a little bit. And I'd be like, what the fuck? I'm like, my left elbow does hurt. I'm like, fix it. And he's seeing your gait, I guess, and like what you're laboring, and like, is your shoulder down? Is this one down? Right. And I have no idea, but I always thought it was real, and I'm glad that you are confirming this for me.
Oh, definitely. No, I work closely with the D. Crescenzo group, and this woman named Shadi. She's excellent.
She's tiny. She was the first person to ever adjust my back in Rhode Island.
She's awesome.
In the East Providence location.
And there's a woman that works in the East Providence office. It's Annie. She's awesome too. Those two.
Shadi
and she's awesome.
She has adjusted my back before I found my guy. And
she might not recognize you now.
She might not. She's like 5'1" too, and I was like, at that point, kind of still strong and like a big guy. And I remember she like hopped on my hip, and I was like, how did she do that?
She's good at what she does.
Yeah. Okay. Good. So we can go back there.
Oh yeah. She loves her practice. She has no kids. It's all about working hard and vacationing. So when you're there, she's all over you.
Yeah. That's good to hear that this is a thing.
Yeah.
Because I was worried that you were going to say, whatever you're feeling isn't real.
Not true.
And I watch, like, to fall asleep at night sometimes, I watch chiropractic videos because of the cracking thing.
Right.
Isn't it supposed to, like, but
it eases me.
Yeah, doesn't it also relax you too?
Yeah.
Yeah.
Right.
I don't even need to be adjusted. I can just watch it happen, and I feel great.
They're crying or colicky or whatever, they get them adjusted sometimes so they'll calm down, right?
They do like the little tiny thing. I see them do it on the videos. They do this thing and they one crack. I walk on his back.
More than most people.
Is that a good thing?
You're not a chiropractor.
By the way, if I'm telling you right now, I said it the other day, if I did another thing, that would 100% be what I do in life. Because I like the feeling of like relief, I guess.
Yeah, that's what it is.
I was going to say release.
Yeah, that would have been bad. That would have been a real.
Relief.
That would have been a real.
I like the feeling of relief. And when you pop that SI joint, or you have that one pop in the middle of the back, or they do the thing, they call it the hug, where they like stand up above you and boom, like pull your head up this way.
You're
Amazing.
really into this.
Yeah, and then they do the humdinger. You ever heard of the humdinger? The humdinger.
Well,
you lie down. They put the strap. They put the towel on. They put the strap on you, and they pull you this way, and you feel it like right down to your feet. So we got to get a new spot and go all day.
Is it good that he'll walk on my back to crack it? Does that medically not good?
I don't know if I'd let him do it.
We
Well,
both,
I mean,
he walks on mine after. That's what's scary.
What do you mean? You're just as much as I
I know. We're walking on the same human being. We're like two of the same exact humans.
It's fine.
Standing.
I feel
on each
better
other.
after it.
Feels great.
Yeah.
It does feel great. We don't know what we're doing though. Also, they tell you don't watch the videos and try to do the things
yourself, right?
Yeah, because there are some that you can do. I tried to do one in the door the other day. The inside of the door, we couldn't get it. Probably because we're too fat.
Yeah, we're not pliable
Yeah,
enough.
and
to
you
do
can
that.
get your SI joint if you do it a certain way, and you do feel it pop, but it's not like perfect. But I got to figure out how to do that.
You guys should get an inversion table in here.
Oh,
Is that a thing?
Yes,
We
they
do that?
definitely help. You
yeah,
only gotta
that
be
thing
there very long.
works, man.
You should get a lot. You got a lot of room here.
You know,
could
I
fit one
almost,
right there.
I almost bought one
That
of those.
actually, that's a great idea.
That is a great
That
idea.
thing works.
I almost bought one of those pump things. You know, have you seen those? It looks like an accordion around your neck, and you pump it up, and it keeps on blowing up, and then eventually it's like pops all the bones in your neck. So that'll be next time.
Did you see that on social media?
I definitely did. So, all right. So, what's the website? How do we go to your CBD
So
website?
the website's backtobasicsllc.com. BAK2 basicsllc.com.
2basicsllc.com.
Just,
By the way,
just
my
use Dr. Rocco
chiropractor's
CBD. It pops up usually.
my
There you go.
chiropractor's place is called Back to Basics. By the way,
There's a
so
In,
there's in Narragansett.
well, there's a store in
Yeah.
East Greenwich too.
Yeah,
Back to
it was the
Basics,
worst
too.
name. I had nothing to do with it. It was the
Back to
worst name
Basics.
because there's one right. There's the other places that sound the same.
Yeah,
Just
Dr. Rocco. You got a
just
good,
search
you got a good name.
Dr. Rocco CBD Rhode Island pops right up.
Okay, so and then we can
Perfect.
go there. We can get our CBD. We're gonna
CBD,
call
but
you.
main thing, just call and I can I help people out and get the right dosing, the right product. It depends.
And
on
it's the
what
only
you're
one with the doctor in the state.
right. Exactly.
And then we can try we can do the other
And
one.
then if you need the other one,
Yeah.
if you hit the criteria, then we could work with that. That's easy to do.
Well, a few surgeries later, there's
criteria. I'm sure that we hit the criteria.
Exactly. We hit the criteria.
I'm sure. What meets criteria? Previous surgeries, move
What's
like
the
you're
word?
20
What's the
years
worst
older
surgery
than
to
you
come
should.
back from? In your opinion, what's the hardest?
Oh, there's so many. If you talk about orthopedic,
Orthopedic, shoulder, knee, elbow,
I find
ankle.
people that do both knees at the same time, it's really hard.
Yeah, you're
Yeah,
crazy.
that's gotta be hard.
Because you have no place to put your weight.
Yeah, you know,
But they want them to get up and walk around as
Immediately.
soon as possible
Right.
too.
Because you don't want to get blood clots and you want to get the knee moving. So it doesn't like people that
So a double D.
double knees are the worst. Because
What about double hip? Is that easier or harder?
That sounds like a pain.
It's
He
easier.
just shook his
I think
head.
it's easier.
No problem.
I've just seen patients, but the knee, like the knees especially, like if you get your surgery, just say one knee, you don't move it. They sometimes have to put you under anesthesia to get the scar tissue moving again. Like those are the
Right.
really
Yeah.
lazy
Yeah.
patients. I mean, it's ridiculous.
Are you worried about your hips at all? Do you have bad hips?
Oh, I bowled one time and I couldn't walk for a
That
week.
was bad.
No,
You
it
did
was-
bowl. We played like 4 frames, and you were like, "My hip."
No,
is
I played all
broken.
10, which doesn't make it any better. But yeah, that's going to be a problem.
My hips.
I think the
feel
shoulder. There's like a shoulder though.
Shoulders are
Shoulder sucks.
suck.
And
Well,
I've had the
at least
knee,
you have to
ankle. The shoulder was by far the worst.
But you don't have to put weight on it. I mean, just
No, you can't move it for
You can't
7
move it.
weeks
You
either.
just put it in a
afterwards.
sling.
And you're in a
Yeah.
sling. I slept on a goddamn lazy boy for 2 months.
So have you done all those surgeries? Have you
So I'm
most
trained.
of the ortho stuff?
No, I'm trained in general, which is
Right, you did, but-
abdominal.
But now you're doing a lot of things with
I'm
ortho,
just
but
doing.
it's on
I'm
the
all I'm doing-
injection
I'm
stuff.
just doing the injection
So
side.
do you get in the room though?
Does he
and
not
see the
listen?
No, I got it.
No, are you sure you got it
No,
now?
I wondered if he
I've
was in the
seen-
room at least.
I've seen back surgeries.
Yeah.
Kind of just get an idea of what they're doing, but mainly,
Yeah.
the reason why this is easy, like doing these injections compared to taking out somebody's colon.
Yeah.
This is nothing.
Right.
I would assume.
I mean, it's nothing. This is like playing a video game. You got the screen.
Yep.
It's better than Xbox. And you're right there. You got your person there.
The reason I wondered
It
about
helps.
the ortho thing was because I have my ortho video on mine, and the elbow I had Tommy John, where it's they like fillet your arm open, and it's gross. It's
gotta be.
Like it's not what do you call it? Arthroscopic.
Arthroscopic, yep.
It's like no, let's just lay your whole entire arm open, and we'll get in there and figure it out once we get in. How was your knee done? You didn't have any
Actually,
knee done?
I had my knee was a scope basically.
What about your shoulder? They opened up the shoulder.
I was
Zipper?
on the front and the back.
double zipper.
I got everything in my shoulder. That's what happens when a 350-pound man falls on your back. That was a bad one.
I don't know how you played so many years.
That one, that was 3 years in, and that was in 2005, my third year.
So you played a lot of years
And
after
with the
that, then.
technology
8 years? Yeah.
that has come along, like 10 years earlier, I would have been done. There was no way they could have fixed what
Your
happened.
knee, was it just like a labrum tear?
No, I did a partial MCL, and it was weird. My ACL popped off, so I didn't have to get a graft in there.
Put it back on?
The doctor, and this isn't like a knock on anything, the doctor said you see this injury more in like teenage girls. Like it just popped on, so they were just able to tack it back on. So they didn't really have to slice me open on that one.
No, we had a kid. I coached Portsmouth High School football, and he had his labrum cleaned out. I couldn't believe, just with a couple of holes. 3 weeks later, he's playing on the team. He's running faster.
And that's like Bo Jackson, right? Or the hip and labrum, right?
Well, this is the knee.
The knee one, okay.
Yeah, it was his hip, but it's amazing what they can do now. I mean, it's unbelievable.
Yeah, ACL years ago, you were done, and now it's like 6 months and you're back. And the dude from
might not even be that long anymore.
The running back from the Rams this year, Achilles.
Yeah.
He came back from Achilles in like 8 months.
Was that?
It's unbelievable.
That was incredible. I mean, mine was. I mean, this. I didn't have Andrews do mine. I had the Astros doctor do mine, but I came back in 11 months.
Never go to your doctor. Never go to the team doctor. Never.
I know. I should have. I didn't know that at that time. Well, no, my guy was good though. He was an elbow specialist.
Is Andrews still
He has all of his disciples doing it now.
I mean,
that's the
his
thing.
name's been around.
That's what happened. I don't think he's done a surgery in years.
I don't think he hasn't probably done one in 20 years. Yeah. But like what happened was all of his disciples all became a lot of these a lot of the best ones, but also a lot of team docs. Yeah. Where it was like the team surgeon for a place came from Disciples Camp. I mean, not Disciples Camp. Andrews Camp.
Clinic or whatever they call it now.
I remember as a kid, everybody went to Andrews.
Well, he's the only one that could do it for a while. But him and Yoko or something did Tommy John's, and mine was mine was a 100% tear, and they took mine from my left wrist, and they were at that time usually taking it from people's same arm, but my thing. Whatever that thing is right there was like twice as skinny. This one was twice as fat.
Really?
So they took this one instead, and they only figure that out once they go, you're asleep. Right, yeah. So I don't know what the hell was going on. The funny thing was though,
3 times.
The funny thing was though, this is my dad will like this story. So I get surgery. I'm whacked out of my brain. Like after I'm like telling people, "Thank you, I love you." This is, I get in the hotel, the hospital room, like the recovery, and my dad's in there. I'm like kind of coming to, and like I got this arm all banged up because they just had it wide open, but they also got this arm all banged up. I'm like, and like a few hours later, I'm like, I got to take a shit. Like, what am I gonna do? So my dad's sitting there. He's like, let me call the nurse. Like, get the nurse in here. So I go in. The nurse, big old lady, down in Houston, gets me in there, and I'm like, how do I wipe? And she's like, I got you, honey. Like, I'll wipe you. And I'm like, this is not normal. Like, I don't like this. And it was like a post-surgery dump too.
God bless her.
Oh, God bless her.
God, no one would want to do that.
God bless her. Yeah.
Oh,
nurses don't get paid enough.
No, they don't.
They do not get paid enough.
You got that plug in there for Max.
Right there,
that's true. Well, I don't know. She's a traveling nurse once in a while, right? So
she's a hard worker.
Hard worker. That's a big check though in those couple months.
She's getting married. She should get a raise.
Yeah,
that's true.
Yeah, put in some good words.
Yeah, that's true. Well, Doc, this was fun.
Yeah,
we learned a lot today.
Yeah, I think we improved ourselves.
I think that after this, when we stop, wherever we're gonna go to his site, and then we'll really improve ourselves.
There you go.
Okay,
perfect.
All right, thanks, Doc.
You're welcome.
Thanks, Doc.
Thanks for having this. Awesome.
Yeah, we have fun.
We'll do it again anytime you want.
Anytime.
Past Our Prime is brought to you by Squadlocker. Squadlocker is your one-stop shop for custom team apparel, delivered right to your front door. Learn more by visiting squadlocker.com.